Hi, everyone, and welcome back to another episode of Chats with Your Advocate. So, for those of you who are new here, I'm Tiffany James, founder and CEO of Divine Wellness Partners. I am a board certified patient advocate and family nurse practitioner. So, before we get started, a quick disclaimer. This chat is for educational purposes only and does not constitute medical advice or establish a patient provider relationship. Always check with your healthcare team before making any changes to your healthcare regimen. So today I thought I would take some time to just answer some questions. The one we get most often is, Tiffany, what exactly does Divine Wellness Partners do? Well, honestly, I love this question because it gives me the opportunity to not only share what we do, but why we do it. So, the best place to start is, how did Divine Wellness Partners begin? I think understanding our why will help you understand everything else. So, I've been a nurse since 2009 and a nurse practitioner since 2014. And throughout my career, I've worked in a variety of settings. So, family practice, urgent care, skilled nursing and long-term care, in community health, all the settings. And so no matter where I worked, one thing that I saw consistently was that patients weren't necessarily failing healthcare. Healthcare was failing to connect the dots for patients. Not always, but frequently. Patients would leave the hospitals overwhelmed. Patients and families didn't know what questions to ask. Caregivers were just exhausted, and providers we're doing our best, but patients are limited, or appointments are limited. Healthcare is fragmented, and patients often found themselves trying to put puzzle pieces together all alone, even with a well thought out discharge plan. Well, then I began navigating my own healthcare complexities and experienced firsthand what it's like to navigate multiple specialists, have to self-advocate literally to save my life, search for answers, and to no avail. So even as an MP, I saw how difficult it was to navigate the healthcare system as a patient. And those experiences shaped this practice. So when Divine Wellness Partners first started, we were an advocacy practice solely. Our mission was to help people better understand healthcare and confidently navigate it. Well, then something happened. And so the more people we served, the more we realized that advocacy alone was just not enough. People needed clinical support and counseling, and caregivers needed guidance, and healthcare providers needed trusted community partners. So instead of changing our mission, we expanded how we fulfilled it. So every service that we offer today grew directly from the needs of the people we were already serving. So another question, well, what is your mission? Our mission is simple. Still, to improve health literacy, strengthen self-advocacy, and provide compassionate support during healthcare transitions. The vision remains the same. We want healthier communities where people feel informed, empowered, supported, and connected through their healthcare journey. It all comes back to that one belief that healthcare works better when people understand it. And I will go on record always and say I am a huge proponent of shared medical decision making and self-advocacy. So when we talk about what exactly we do in terms of our service arms, it's pretty much two things. The first is patient advocacy. Again, that's how we started. And the second is care navigation and transitional support. And that includes both from a medical and behavioral health standpoint when it comes to transitions. Now, when we talk about patient advocacy, as a board certified patient advocate, or BCPA, our role is to educate, empower, support patients and families as they navigate healthcare. It's very important to do that, okay? And for us at Divine Wellness Partners, advocacy really means helping those people to understand and have the confidence to participate in their care. So it could be helping someone prepare for appointments, understand a diagnosis better, review medications, organize medical information, navigate insurance hurdles, find community resources Support caregivers are simply helping them understand where to go to ask the questions. That arm is available nationwide, and we aren't limited by location, okay, at all. We work with individuals, we work with caregivers, we work with families across all healthcare settings. So we go into the hospital setting, rehabs, assisted living, outpatient care, wherever is needed to help people navigate either their medical or behavioral health concerns. Okay. And so for care navigation and transitional support, that's our second arm. And that is where our clinical roles come in. Me as a nurse practitioner and Dr. Graham is as a licensed clinical social worker and therapist. Understand that I am a primary care nurse practitioner always, right? So I've simply chosen to focus on healthcare transitions and major life changes. So we're not a replacement to the primary care provider. We're strengthening the work that they already do. We serve as another member of the healthcare team, okay? Medical transitions might include someone who's recently been discharged from the hospital, someone who's recovering after rehab, or someone managing multiple chronic illnesses, someone seeing several specialists, or someone who simply needs some additional support to get back on track. Our goal is to improve communication, coordinate care, reinforce the treatment plan, provide education, and help patients not fall through the cracks during vulnerable times. Behavioral health transitions are equally important, and so our COO, Dr. Sandra Graham, again, she's a licensed clinical social worker, board-certified patient advocate, and she's our executive director of behavioral health initiatives. So her focus is solely on mental health, but again, she's our COO and really helps with all the things. She provides counseling, emotional support for individuals experiencing anxiety, depression, caregiver stress, burnout, chronic illness, compassion fatigue, and all of those transitions. We believe that healing is not just physical. Mental health is health. So together, our goal is to support the whole person during life's transitions, not just their diagnosis, okay? So we're also excited to continue expanding our behavioral health services into Georgia as we build partnerships there. So when we talk about where we provide services, again, advocacy is available nationwide. And then our care navigation services and transitional support services are right now available in Florida. We are in the outpatient settings, so not in the hospital, but we can go into the ALFs, we can go into the home for the medical side. And then for behavioral health support, it's all telehealth. Focused right now. Another question we get is, do you accept insurance? Our advocacy services are all self-pay because patient advocacy is generally not covered by insurance, although it should be. And then our care navigation transitional support services are available for the medical side, Medicare and Medicaid. And then with behavioral health, Dr. Graham has several insurances that she takes with Medicare pending. But again, just if you have questions, just let us know. We can always look and see if we're in network with your plan. Another question we get, well, who is a good referral? Honestly, if someone is overwhelmed navigating healthcare, they're probably a good referral. So some examples, someone recently discharged from the hospital, someone with chronic conditions, multiple conditions, someone seeing several specialists, a caregiver who feels overwhelmed, or someone newly diagnosed with a serious illness, someone who's relocated to the area and doesn't have a primary, recent urgent care visit, and just no follow-up and they need more care, someone frequently utilizing the ER because they need additional support, or someone facing medical or behavioral health transitions and they need that support, so if you're not quite sure, we do a discovery call because, again, healthcare is complex. So with that discovery call, it's a free 15-minute call. And based on that, we get to know the person and their situation, and that allows us to plug them in appropriately to whatever service arm would best support their needs. Sometimes that's advocacy, where they just need that support to walk alongside them, that additional resource, but they don't need provider-led care. Sometimes it's transitional support where you need a provider to step in and manage certain things. And then again, counseling sometimes. So it really just depends, which is why that discovery call is so important. Yes, and another thing that we get is just, why are you focused so much on community? Well, Health doesn't happen in isolation. You need community. One organization cannot meet every need. That's why you'll see us partnering with physicians, therapists, hospitalists, home health agencies, senior organizations, nonprofits, churches, all the things. Because the stronger our referral network becomes, the better we can serve patients and families. Health literacy is one of the biggest passions we have, and we believe that the more that we can connect and collaborate, we can support those things. So when people understand their health, they make informed decisions. They feel more confident and often experience better outcomes. We have to be able to work together as a team to support that. One person cannot do it all. One company cannot do it all. So if you're mission focused, you have good values, and you're here for the patients, we're here for you. Okay. And so that's just something that I want to make very, very clear. So you will see us everywhere, and that is intentional, because we want people to know we're here. We want people to know why, and we want people to know that we are a resource for your patients, your loved ones, your colleagues. We're here. Okay. And so when we talk about what's next for Divine Wellness Partners, well, we are going to be going live in person with our Chats with Your Advocate. So coming up in August, you will see that as a post to follow. We've created this series intentionally, again, to focus on health literacy, to make healthcare less overwhelming. So further details to come. We did have our first live session back in January at Onyx Gifts and Books over cervical cancer awareness, and it was amazing. So people asked for more, and we listened. So we've been quietly working in the background to bring that to fruition. And so our first live event will be August 22nd in partnership with Live Inspired Brevard. We are so excited about that. They will be a featured vendor with us there. So at that event, we'll be discussing a lot of great topics. So stay tuned for that. We will post that, okay? And so, again, if you have more questions, if you want to know a little more, if you want us to come out, let us know. Our mission, again, is to just focus on getting the information out and supporting those healthy communities. It takes a village, so drop any questions in the comments, please, on YouTube, subscribe. Share. We want to let people know that we're here. Okay. Thank you so much for joining me today. It's been a pleasure. And again, we are here. Ask questions. Let us know how we can help. Okay. In the description box, you will also notice a link from the Orlando Voyager. I had the pleasure of being interviewed by them, where we really broke down my health journey and what led me to be so passionate about advocacy. So take a look at that link in the description box. That'll give you even more understanding as to why we are so passionate about what we're doing. So anyway, we're here. And until next time, remember, you don't have to navigate this alone. We are a team here to walk alongside you every step of the way. Take care.